Section 20, subsection 1 of the National Health Act 2014 states that a healthcare provider, health worker, or health establishment shall not refuse a person emergency medical treatment for any reason whatsoever. Okay, any reason whatsoever. This reasons covers all the common excuses for delayed care, which includes the type of disease, mandatory deposit, or police report for gunshot wounds. I had to do this research, okay? So I'm going to let you guys know that as a patient, you have a right to emergency care. So that means even if you don't have the deposit and all that, as long as it is a case of an emergency, you have a right to be given care at that moment. Hi my loves, Z here. Welcome to my YouTube channel. If you're seeing my beautiful face for the first time, welcome. My name is Z and I'm a registered nurse, midwife and public health practitioner, licensed and practicing here in Nigeria, okay? And I create content surrounding health, lifestyle and vlogs. If you have not subscribed to my channel, now is a good time to do that, okay? So yes guys, in today's video, I'm going to be educating you on your rights as a patient in any healthcare facilities here in Nigeria. If that sounds like something you'd like to see, watch till the very end of this video. So guys, let's get right into this video. First of all, let's start with who a patient is. So a patient is someone that is seeking healthcare, someone that is ill, being treated for any ailment in a medical facility. I do hope that's like a layman term of who a patient is, so you guys would understand. You know, over here we like to make things as simple and understandable as possible, okay? Now, your rights as a patient, these are rights attributed to people that are seeking medical care. Well, now, why am I bringing this to you, okay? I want you to know what can be done and what can't be done to you in the healthcare facilities. I'm bringing this because a couple of people I saw online that a couple of people have been complaining about, I went to the hospital, this happened. Is this even allowed? Is this legal? Okay, so I'm here as my OGs to tell you things that are not supposed to be, things that are illegal from your healthcare practitioners, as one that I am, to you as a patient. So it's imminent that you know this, so that you know when to put a stop to some things that have been done to you in a hospital. Okay, so now let's get right into this, into your rights. Yes, the very first right that I would like to let you know is, as a patient, you have a right to information. Now, what does this mean? This means that as a patient, you have a right to knowing your what treatment you are being given, when the prognosis, like what are the long-term goal, what's your long-term goal for treatment, what is the what's the condition, like literally your regimen of treatment, all those kind of, you have a right to know whatever is being done for you, and then you have a right to know all the possible procedures, okay? Now that brings us to my next right. As a patient, you have a right to informed consent. Now, after you've gotten all the information that you have a right to agree. Literally, you have a right to providing consent. So that means if you do not agree to a particular treatment regimen, then it cannot be done to you. You absolutely cannot be forced to get any kind of treatment regimen. And now, informed consent means you have to pen down, or there will have to be a legal tender in quotes of you consenting to a particular treatment regimen, mostly done when there's an invasive procedure, like you have a surgery, you have to sign it down. So you have a right to consenting to that surgery or that procedure or not. Another very common, what's the word now that we have in the hospital is people consenting to blood transfusion. We have a particular doctrine that doesn't accept blood transfusion. So you absolutely have a right to accept or not to be transfused with blood, okay? Because before you're even transfused with blood, you are ideally supposed to sign a written consent to approve that you are given blood transfusion, okay? So now that brings us to the next right you should know as a patient. Another right that you should know as a patient is your right to your treatment choice. Like I stated before, you have to be informed about all the possible regimens to go. Then you are the one that will now choose what's right. With the informed consent I spoke about, right? So informed consent is your healthcare provider is supposed to tell you the risk associated with every of the treatment regimen. Then you are supposed to choose which of these treatment regimen you want to go with. Does that make sense? I hope it does, okay? Now, another of your rights is your right to refuse treatment, just like I stated before, okay? So you can't be forced to take any form of treatment in any healthcare facilities, at least in Nigeria I know of, okay, because I'm working here, I'm practicing here, and I know what operates. So you cannot be forced to take any form of treatment. Now, another very important right you should know as a patient is your right to confidentiality and privacy. Now, before, I think those are like two different rights, but I just merged them together and I would explain why. Now, privacy means when you're in a healthcare, when you're in a hospital, in quotes, because it might just be like any clinic and all that, but like when you are going to seek health care, you have a right to have your own privacy amongst other patients. So now there are some procedures that might be carried out, and then you have a right to tell your healthcare provider that you want some sort of privacy from other patients or something like that. Yeah, then confidentiality. Now, this is very important because some patients do not know that your healthcare provider does not have any right whatsoever to tell any other person that you do not approve of about your health condition. Anybody at all, okay? Now, there's this very controversial issue that happens in Nigeria where employers take their employees to the hospital to test for HIV and all of that before they are employed, okay? Now, even with that, it is not possible for your healthcare provider, or let me not say not possible, not appropriate for your healthcare provider to even inform your employees of your health condition except you approve of it. They only have a right to tell you what your health condition is. Then you have your liberty to tell your employers rather, if you want to tell them or not. So confidentiality is your right as a patient. You have absolute right to not let anybody that you don't approve of know of your health condition, okay? So like I stated, you can, go to court if you want to, but yes, there's a clause to the law, right, that accompanies confidentiality. So your healthcare provider has no right whatsoever to share any information about your health with anybody you don't approve of, except when it is of public interest, okay? So now I'm going to give an example of, for those that were first tested of COVID positive, their health information would have been used for further research to find vaccines, okay? Like I said, those that only when it is of public interest, okay? Like they need your health information as some form of statistics to provide a vaccine or something of that sort. But any other thing aside that, anybody else, even if you're parents, as long as you are of age, like your legal age, Nigerian legal age of 18, you have a right, okay, to say no to any other person knowing your health condition except you. Do you understand? And when I say any other person, it doesn't mean those working, like not your health team. I'm talking of like outside, okay? Because your health team, they all need to know your health condition to actually provide care for you. Do you understand me, okay? So now, one other very important right you should know as a patient, and then this one, you guys, I have my book here, okay? That's why I'm looking down. So this one, I'm going to have to read it out to you because like I said, you're my OGs, so I went to make this research for you, okay? So as a patient, you have a right to emergency treatment without discrimination, okay? Like I said, this one, I had to get my legal backings to tell you guys straight up, okay? So Section 20, subsection 1 of the National Health Act 2014 states that a healthcare provider, health worker, or health establishment shall not refuse a person emergency medical treatment for any reason whatsoever. Okay? Any reason whatsoever. That is what the law states. Do you understand? And they further went ahead to say, and then this reasons covers all the common excuses for delayed care, which includes the type of disease, mandatory deposit, or police report for gunshot wounds. I had to do this research, okay? So I'm going to let you guys know that as a patient, you have a right to emergency care. So that means even if you don't have the deposit and all that, as long as it is a case of an emergency, you have a right to be given care at that moment. That means your healthcare provider has no right whatsoever to deny you of care in an emergency just for those reasons, menial reasons like I mentioned. Like there should be no delay of care for reasons like the mandatory deposit and police report for gunshot wound. Before all those things are asked for, you should be provided emergency care at the very least. So now that you know, do with that information what you will, okay? So but then again, I would like to clarify something, right? With this emergency care, now in the emergency unit, there's something we call triage. Okay, an emergency for you might not be as much as an emergency for someone else. So just because you go to the emergency unit and then you are in some sort of emergency, and then you believe, oh, you arrived there first, and then someone else comes and then they're trying to attend to that person first, it just goes to show that that person's emergency is on a higher scale than yours. So now, if you are in an emergency unit as a patient, and then there's a patient that in the next 2 seconds or 2 minutes, if something is not done, that patient could pass on. And then for you, your situation is something that even if you are left for 1 hour, you wouldn't pass on. They will most likely attend to that other person first because it's higher up there on the scale, okay? Do you understand? So in situations like that, you really cannot sue. But in situations where your emergency is actual emergency, like the most emergency situation in that institution at the moment, and they refuse to attend to you for these menial reasons, like I stated earlier, do with that information what you will. But you have a right to emergency treatment here in Nigeria. This law stuff that I just read now is from the Nigerian National Health Act. Okay, not even from the abroad. It is in national, so you can actually take it to your legal representative. Okay, so now another right that I think you should know is you as a patient here in Nigeria, you have a right to obtain your medical records. Now, what does this mean? It means that if in a situation where you have to, travel out of the country or go anywhere, even if you're still in the country, just you need your health records to maybe further treatment or to even prove anything, you have a right to it as a patient. Now, this same National Act under Section 23, subsection 1, provides patients in Nigeria rights to obtain medical records, including medical practitioner's notes, your medical test, and other documentations from your health care. Okay, so you as a patient have a right to these documents. You can always ask for it and let them know that they should provide. They would not give you the original document most times. They can just probably provide a photocopy of this data to you when it is needed, but you have a right to get those information, okay? Another very important but underrated right that you should know as a patient is you have a right to considerate and respectful care. You have a right to be respected regardless of your age, regardless of your status. You have a right to be cared for in a respectable manner. This is probably not something you can sue for, but I just want you to know that you have that right as a patient. Like I stated, regardless of social status, regardless of financial status, regardless of age, gender, you have that right, okay? So now, one tip of the iceberg that I want you as patients to know is that in Nigeria, with the confidentiality that I spoke about, if there's a breach of your confidentiality, it means that any information of your healthcare goes out there, like leaves the health providers and then gets to people that you don't want it to get to, and it is traced back that the fault came from one of the people there is a fine to be paid by that healthcare provider of 250,000 naira or 2 years in prison. Like I stated earlier, do with that information what you will. So a summary of the rights that I mentioned, right? So the first is you have your rights to information of your health care. You have second one, you have a right to informed consent. You have a right to refuse treatment. You have a right to your choice of treatment. You have a right to your privacy and confidentiality. You have a right to emergency treatment. Yes, you have a right to considerate and respectful care. There might be other rights that I didn't mention, but I just think these are like the very important ones that you should know. Okay, I do hope that you've enjoyed watching this video. If you have not liked this video, now is a good time to give me a thumbs up. If you've not commented, share your experiences with me in the comment section of if any of this your rights has been violated at any point of getting treatment here in Nigeria. Has any of your rights been violated? Share in the comment section. Let's chat, okay? And then if you found this very helpful, let me know. Give me my flowers, okay? So yes, guys, subscribe if you've not subscribed to my channel. Please subscribe. I have a lot more of back-to-back content for you guys, okay? So please, now is a good time to subscribe to my channel. Watch my other videos that you've not seen. You're probably going to be seeing links to them on your screen right now, okay? So please go back to watch some of my other videos. And yeah, thank you guys for sticking with me, and thank you for watching up to this point. I'll see you in my next one. Bye, guys.